today to do a Foley catheter on my female patient, Mrs. Jones, as ordered by the doctor. This order has been done because she is experiencing some urinary retention. So I am now going to enter the room. Hello, Ms. Johnson. My name is Bruce. I am here to do a Foley catheter. Would you like to show me your wristband and tell me your name and date of birth? Perfect. Alright, so how have you been feeling today? Have you been experiencing any discomfort, pain? And I know with your urinary retention that you feel very uncomfortable at times, so is there anything you want to tell me about? Alright. Alright, so this procedure is going to start with pericare. So for this I am going to need to expose your private parts, so if you feel uncomfortable at any point during this procedure, feel free to let me know. But I'm going to put on some gloves first. And so on my care set right here, it is filled with warm water and some soap.
I was trying to go faster, but I think you're at 12. I need to
Alright, so now I'm going to get your legs into position. Like that. And then the other here. Trying to put some space between the ankles. Alright, I'm now going to roll up your gown. Alright. So now I'm going to clean with the aforementioned rags, starting in one corner and going side, moving to another corner, side, moving to third corner, spreading the labia and going down the middle. Alright, care done. Just gonna move this off to the side. Alright, so now we're gonna prepare for the Foley catheter itself. There can be some discomfort in this procedure, and if you do experience any at any time, feel free to let me know. I'm going to apply this in advance because I find it easier to be done that way. Okay, now to move on to the Foley catheter. Supplies here. Move the paper out the way. Turn this plastic part into a garbage bag for all the used materials from this procedure. Thanks. Plastic being difficult. Okay, there we go. So now on to Foley catheter. I'm going to try my best to use sterile technique here. So I'm going to start moving this one out the way, and I'll move this one out the way. I'll bring this one down, rotate it this way. Now we'll pick up this one. And start gloves. Lights. There you go. They are pre-opened and pre-used. Have to reuse materials for this. So now I'm just going to open my sterile glove kit. Come up for this side, drag these. Alright, stay down. Stay down. Alright, okay. Turn away from the curtain to avoid accidental contamination. We'll be using the scoop technique for the second glove. As difficult as it's choosing to be. There we go. That's the wrong one. There we go. Alright, gloves are on. It's not getting in the way, so I'm not going to toss it quite yet, as to avoid accidentally breaking sterility. Alright, so it looks like here I have the fenestrated drape. I will not be using this today. As per hospital policy, it is not required. So now I'm going to pick up this drape. The shiny side will be down. Try and tuck it under. In a real patient, I would have them lift up their butt a little bit so I could push it in deeper, but this is a mannequin. I will not be using this drape. Bringing it nice up in the air, expanding it, grabbing that side, coming back around, grabbing this side, bringing this between the ankles. Okay, now setting down is here, moving this tray here. All right, next, this will be used for a urine sample. A urine sample can only be taken out of the Foley bag immediately after it's inserted. Setting this here for the time being. Pull this out. I'm going to drag along this so it doesn't start flying around all crazy. Okay. Now I'm going to grab my saline. I'm going to have that inserted for now. Set that there. Okay, do you have any allergies? Oh, you have an allergy to iodine. Good to know. So then this is our iodine here. We'll not be using that. All right, now I'm going to tear lubricating jelly, apply it along there where the syringe was. And so now I'm going to fluff out my cotton balls, which has already been done. Right, and then I will tear my hydrogen peroxide, layer it over those. Right, so I will spread label folds, take a cotton ball, side, toss, side, toss, and then down the middle. I can go way too now. Okay, so now insert this. It's a little lubricating jelly, about 1 to 2 inches, since this is a female patient. All right, now I'm gonna try spread these a little extra. Sorry for the discomfort. Right now I'm gonna insert it. There it goes. All right, so I'm gonna insert it until I start to get some urine return. So let's say I'm getting urine return now. I will then insert it another couple of inches in. And then insert this. And then maneuver it in such a way that I remove it with my sterile hand. And then I can set that over there. All right, so now that is inserted, I will bring the bag over here. Now, since I will no longer be dealing with this, I'll give it a nice little tug. It is in there. Let me give it a little extra slack so it doesn't end up causing some discomfort, and then the patient will be able to lower their leg without it tugging out. So now it is nice in place. Take this and fold it. At this time is where I would do my urine sample. There's no urine. So then I will attach this to a movable part of the bed frame. I see a hook down here meant just for this, so it can go right there. And then that would be the urinary catheter inserted. So now at this time, I will remove sterile gloves. And then perform hand hygiene. So now we will be moving on to the section of removal. I did not have a graduated cylinder with me, but in a hospital setting or for test outs I would, and then I would drain urine out into this graduated cylinder, and then once this urine is drained, then I will remove this. I can just bring it up here for the time being because all this stuff is destined for the trash. Untie since there would be some time before the catheter would be removed, now would also be another good time to ask my patient if they're experiencing any pain or discomfort, or any other concerning things that I should know about. But it's a mannequin, so it cannot respond. So now I will undo this, let that fall for just a little while, untie this, set this to the side, grab my syringe, place it in here, and allow gravity to do its thing. Alright, so Miss Johnson, we're about done with this procedure. Would you like to do your own pericare, or would you like me to do that again for you? You'd like to do it by yourself? It's great. We love it when our patients take their own health care and well-being into their own hands. It looks like the flow is still going. So if the flow were to stop, I would notify the physician, but it's still going. Almost there. Alright, it stopped. Okay. Take that there. Set this off to the side. Alright. Just go ahead, bear down. I'm going to be removing the catheter now. I'm try and hold it up close so urine's not flinging around everywhere. So now, I'll set that just in there for the time being. So that concludes the removal and the insertion. At this point now, I would change my gloves since I had just dealt with the catheter and don't want to spread urine everywhere, and perform hand hygiene, and then gather up all my used materials, discard what is meant to be, and then give them the necessary resources that they need to do their own pericare. So, if there's anything else that you need or want to ask of me, now would be the time. If not, your call light will be nearby, so then you can just let me know. I will raise the bed rail and then start removing everything. Thank you for your compliance.